7 ways to reduce creatinine levels and quickly normalize your kidney function. If this is your first time of seeing this page, kindly subscribe to this page for more educational content. Reducing creatinine levels and normalizing kidney function involves combination of both medical treatment, lifestyle changes, and dietary adjustments, and they include: 1. Staying hydrated. The importance is that dehydration can lead to increase in your creatinine levels, so endeavor to drink at least 8 to 10 glasses of water daily if you are an adult. Modify your diet. Reduce protein-rich foods as it can increase your creatinine levels, red meat and other protein-rich foods. Also, increase your fiber. Fiber helps to reduce creatinine levels. Avoid creatinine-rich foods like red meat, dairy products, and fish containing creatinine. Limiting these can change your creatinine levels. The next one is control hypertension. High blood pressure can damage kidneys. Use medication as prescribed and maintain a low sodium diet to control your blood pressure. The next one is control diabetes. High blood sugar can lead to kidney damage. Monitor blood glucose levels and adhere to a diabetes-friendly diet to reduce your blood sugar. Use of herbal remedies, but with caution. The first one is chamomile tea can help to reduce your creatinine level. Stinging nettle acts as a natural diuretic that can help you eliminate waste. Always consult your doctor or your healthcare provider if you want to use any herbal supplement to avoid adverse interaction or side effects. Avoid nephrotoxic medications. Medications like NSAID that are used for pain management and antibiotics, some blood pressure medication affect kidney function. Exercise. Moderate exercise can help you improve your kidney function. At least aim at 30 minutes exercise daily. Then avoid overexertion exercise. Extreme workout is not good for you. Medical treatment. Dialysis is the first on the list. In severe cases, kidney dysfunction, dialysis may be required to remove excess waste or creatinine in the blood. Medication. Doctors may prescribe medication to help manage the underlying causes of high creatinine, whether it is hypertension causing it or diabetes causing it. Monitoring. You should regularly monitor your blood creatinine levels and kidney function and can help you manage and adjust your treatment plan effectively. So always monitor your blood for all this. Additional tips: weight management. Maintain a healthy weight to reduce the strain on your kidneys. Quit smoking and limit alcohol use because it damages the kidneys. Reducing creatinine levels and normalizing your kidney function requires your personal approach like dietary changes and the rest. Always consult your doctor. See you in my next video. Bye.